Item number 12 is a resolution submitted by Councilors Scott, Ewan, Campen, and Davis, proposing a process to create the Somerville Community Safety Coalition.
Councilor Scott.
Thank you, Mr. President. I bring this resolution before you tonight, and I believe Mr. Long is about to present the text of this resolution, both as a resolution in hopes of adoption, but also as a starting point. During budget season, there was a lot of conversation about the need to reduce our reliance on the police department, especially when it comes to mental health and substance addiction related calls. The process of reimagining the police department was one that our mayor committed to, and that many people expressed eagerness towards. And we were told that process would start in October and would be spearheaded by the new Director of Racial and Social Justice. Well, here we are. Our next meeting of the City Council will not be in October, it will be in November. And that job for that director level position was only posted, I believe, last week. So we at the City Council have not been content to simply wait for somebody else to lead that process. I know that myself and several others have been working on various aspects of accountability as it relates to our police department, and specifically begun that process with residents to reimagine what a police department can look like. Tonight, I'd like to sponsor Sarah Courtney. Sarah Courtney is a professional with an impressive resume of her own, Ward 1 resident, and somebody who has actually worked with our Department of Health and Human Services in the past. She has a, I think, breathtaking proposal, but one that is very workable. It is also one that requires the commitment of time, energy, and resources to make work. I'll leave it to her to describe this process. But the sequential intercept model that she'll describe tonight, I think, has a very practical, real opportunity to be applied to our community to start this process toward meaningful change that is guided by and rooted in our community to create a safer society for everyone. So on this item number 12, I would like to sponsor Ms. Sarah Courtney to speak. Mr. President.
All right, Councilor Scott would like to sponsor Sarah Courtney to speak. Hearing no objections, Sarah, you have the floor.
Good evening and thank you. My name is Sarah Courtney. I am a licensed social worker and I've worked in the state of Massachusetts in different communities for the last 8 years, and I've specialized with mental illness and substance addiction disorders. And for these reasons, I'm very interested in convening what could be called the Somerville Safety Coalition, a community safety coalition to address the needs of our residents, our neighbors who have mental illness and substance addictions. What we know is that individuals with substance addiction and mental illness are overrepresented in incarcerated populations and may be incarcerated for up to 2 times as long as those without severe mental illness, even when controlling for race, socioeconomic status, and age. And this is not just an issue of ability or different abilities, but also one of race. We know that in Massachusetts, our Black residents are overrepresented in our incarcerated populations and underrepresented in both our substance addiction and mental health treatment systems. When we think about what does it mean to have community safety, we know that access to quality mental health treatment is the most effective tool for ensuring both health of our residents, our individuals, and safety for our community. And in order to support that, I would like to propose the convening of the Somerville Community Safety Coalition to do a sequential intercept model. The sequential intercept model is a validated tool that is used by groups of stakeholders. In this case, stakeholders in the Somerville community, both professionals in the community who work in nonprofits in mental health and substance addiction disorder treatment, and also professionals at the city level. We would evaluate in this coalition different intercepts from 0, which is community-based services, all the way to intercept 5, which is community corrections, probation, and parole, to divert individuals with mental illness and substance addiction out of the criminal justice system into a network of community treatment that is specialized for mental illness and substance addiction care. Next slide, please. So hopefully in this coalition, after doing this mapping project to identify ways that we can, as a community, come together to support our residents with mental illness and substance addiction, we can move from this question, how do we better prepare the police to respond, to how do we partner with our community and the police to enable referrals to accurate, to adequate and quality treatment services, and eventually create an opportunity for an emergency response specifically designed to assess and meet the needs of our individuals, our community members that have mental illnesses and substance addictions. So this coalition will, I very much appreciate counselors for supporting this coalition, and I hope to be able to work with you all soon. Thank you so much.
Ms. Courtney, when are you envisioning what do you envision the timeline to be of implementation of the safety coalition?
So I believe that to convene stakeholders and use the sequential intercept mapping assessment would take about a year. And then the follow-up to that work. So the sequential intercept mapping will both identify the strengths of our community, what services that we already have, and the model using this collaborative or the coalition will enable our system to be able to refer to one another. But the sequential intercept model map will also identify any gaps in services that could be identified by this group of stakeholders. Those gaps in services in this proposal will then be translated to requests for proposals that will go to the community to help fill in or bridge these gaps of services so that our residents with mental illness and substance addiction have access to the treatment that they need.
As you know, as Councillor Scott said, we all aimed, including the mayor and the administration, all aimed to be much farther along at this point on all of these discussions, and we've had delays for a variety of reasons, some more frustrating than others. But we are where we are, and given the level of thought that's already put into this, it certainly struck me as a good way to dive into the conversation and given the anticipated timeline, hopefully align those efforts with the new director of racial and social justice whenever that person is put into place. But in the meantime, we have work to do, and I certainly agreed with moving this forward so that we can get going and not be starting from a standstill whenever we have the director put in place.
Are you familiar with the Community Outreach Health Recovery Core within the police department?
Yes, I am.
So have you spoken to Ms. Contente?
I have not. The core program is listed in the proposed stakeholders because that would be a very important part of Intercept 1 and 2.
Okay, so the outline and everything makes sense to me. I don't have any issue with that. And it might be because I'm not 100% clear on everything that CORE does. But when I was looking at this, I thought it was redundant. What elements of it are they not doing that your model?
And these are deeply important parts of some of these intercepts in the sequential intercept model. But it is not the entire picture for this model. This model is both looking at when people are already engaged with the police and before and after. So when we look at something like Intercept 0, these crisis lines, the continuum of care in Somerville might look like a program like New Day Recovery. It might look like part of CHA. It might look like our community organizations that provide care for people with mental illness and substance addiction before they've ever interacted with our police department. And hopefully so that they never have to interact with our police department in a way that, you know, they're getting involved in the criminal justice system. It also looks at reentry and reintegration into the community. So in these moments where not just one or not just two programs could address all of the needs that would come up across this entire continuum of care. Intercept 5 and 4 might look like housing support. It might look like family therapy. It might look like education. And what can prevent recidivism, what can prevent interacting with the criminal justice system in the first place.